Sando Sharif has walked for 1.5 hours with her 2 children to get free medical help. Her 1-year-old boy, Jerry, has suspected malaria, the biggest killer of children in Africa today. She says we cannot afford to pay for treatment unless we don't buy food or clothes. It's the second time my child has had this illness. She's one of the 84% of Liberians living on less than 70 pence a day. The country's fighting hard to lift itself out of the mire of 14 years of civil war, but diseases that are simple to prevent and treat are still killing thousands. Health fees were removed by the president 3 years ago, but 60% of state clinics are still closed. The shattered infrastructure and economy dual barriers to progress.
This is where the majority of people in Liberia currently go for their health care, a street drugstore. There are no consultation charges or registration fees. The only catch is the person dispensing the drugs will probably have had no medical training.
There are private clinics, but they're expensive. It means people are turning to more traditional cures. They may have questionable results, but they are cheaper. Fatu Johnson says, I spent all my savings paying to get my infected leg treated. Eventually I came here. I only pay if I get well.
2 or 3 times when you go to the toilet.
Most free treatment is still provided by charities like Save the Children. The funding commitment from Britain means the Liberian government should be able to open more state clinics.
If you don't have citizens that are healthy, then you don't have productive citizens. So the rest of whatever we do depends upon having citizens who can be healthy, who can work, who can make their contribution to the economy and to the nation.
There is, though, still a long way to go. There are, for example, only 700 nurses in the whole country. They need 5,500 so that the new generation, untouched by the war, is able to grow up out of its shadow. Jane Secker, Sky News, Liberia.